Hello, I'm Tina Kaczor, Senior Medical Editor here at the Natural Medicine Journal. I'm in Phoenix, Arizona at the annual convention of the American Association of Naturopathic Physicians, and I'm joined by Dr. Tori Hudson. Dr. Tori Hudson is the Director of Research and Education at Vitanica Supplement Company, the author of Women's Encyclopedia of Natural Medicine, clinical professor at several of the naturopathic medical colleges, as well as medical director at A Woman's Time, a clinic in Portland, Oregon. Thank you for joining me.
My pleasure.
Dr. Hudson, you just finished a lecture on updates in women's health, and I just want you to touch on a few highlights of what you think is most important updates that have happened in the last 2 years or so.
Well, there's always research going on black cohosh. I think I just talked about a couple things today about how even in breast cancer survivors taking tamoxifen, black cohosh was helpful for the majority of their menopause symptoms. So even in the presence of an anti-estrogen, black cohosh was helpful. And I talked about how in this report on 9 cases of suspected hepatotoxicity with black cohosh didn't really pan out. Didn't really seem like there was a cause and effect relationship, except maybe in one of those patients with her gallstones, but yet she might have had pre-existing gallstones. So there was that. I talked a little bit about a HOPS study and hot flashes. So I think this is the second study on HOPS and menopausal women, and it's not, I don't think, a big player, but I think there's a little bit of a role for, especially if they have some insomnia and things like that as well. Talked about DHEA ovules or suppositories for atrophic vaginal changes, as well as actual general sexual dysfunction, meaning libido. So I'm pretty excited about that. Just a nice little simple local treatment every day for 12 weeks. That was the extent of the study, but yet then in practice you have to think, well, what am I going to do now after that?
Right. And
I've just decided I'm going to do now twice a week after that. So I think that's been a new, nice addition to that kind of treatment approach. I think, I'm really comfortable with the soy research. I know not everybody is, in terms of not only safety, in terms of ovarian and endometrial and breast cancer, but actually reducing the risk of ovarian and endometrial cancer. I talked a little bit about that, and I then encourage people to get really schooled on the research in the last couple of years, especially about soy and breast cancer, and how that research leads us with, I think, a very, very, very reassuring conclusion that soy is not only safe for women, but safe for women with breast cancer and safe for women who had breast cancer, and actually it's maybe even have better outcomes if they use soy, even if they're on tamoxifen. A better outcome with tamoxifen. So I hope that went across. Well, I didn't talk about it today, but I always like to mention that green tea ointment for external genital warts, and there's some nice research on that, and I sort of extrapolated that in my practice as green tea suppositories for HPV and atypical pap smears and part of the protocol for cervical dysplasia. Again, I didn't talk about it today, but I think people would want to know about that. Talked about the 5 studies or so on Vitex and cyclic mastalgia. So those were some things I talked about. I talked about mammogram timings and how in reproductive age women doing screening mammography at during their menstrual cycle, those days 1 through 7, seems to be more sensitive. That's kind of cool. And talked a little bit about the timing hypothesis in terms of HRT in menopausal women. Actually, if you do hormones, estrogen alone or estrogen plus progestogens in perimenopausal or within the first 10 years of menopause, it doesn't increase the risk of heart disease. In fact, it more likely reduces the risk of heart disease. And tried to make some distinctions about estrogen by itself seemingly not increasing the risk of breast cancer, and estrogen with progesterone probably not increasing the risk of breast cancer, versus estrogen with progestins. And I tried to emphasize that the worst thing we could say is it slightly increases the risk of breast cancer, even when you take it over the long.
Well, thank you for joining me today.
My pleasure, and thanks for all the good work you're doing on the journal.